Started. Hello, my name is Leah Shanley. I'm the co-executive director of the South Big Data Innovation Hub. We are one of a network of 4 hubs funded by the National Science Foundation. Our role is to create connective tissue between academic researchers in data science and with researchers and practitioners in domain sciences and related fields, and as well as build interdisciplinary partnerships across sectors, connecting academic researchers to government and industry to apply their data science approaches to real-world challenges. Today, we're very excited to launch our Smart and Connected Health Cluster for the South Big Data Innovation Hub. Hopefully, maybe turn into a working group with some concrete tasks in the fall. This is the first, and Tracey Koehlmoos, I hope I'm pronouncing that right, from the Director of Health Services Administration, Division and Associate Professor of Preventative Medicine and Biostatistics at the Uniformed Services University of the Health Sciences, will be joining us today, as well as Jared Elzey, Director of Services and Support Unit Office for Research at Meharry Medical College. We're very delighted to have them lead a conversation today on framing the issues around scientific research in ethics and big data. And before we get started, a little housekeeping. Carl Gustafsson, who's our project manager, asks that folks mute their phones while the presentation is going on, and then we can unmute when we get to the discussion part of the conversation, and also turn off the video for the moment at least, so we conserve our bandwidth. With that, I'll hand it over to our 2 distinguished presenters. Thank you.
Great. Thank you so much for that kind introduction, Leah. And I don't actually see Jared anymore, so I hope that he's here. Jared, are you actually here?
Have I shown up?
Yeah, there you are. So now we should be able to see each other. I've got control of the slides, so I'll be moving through for you all. And again, we're going to be talking, we're going to start this discussion on framing the issues around scientific research in ethics for big data. I think Jared and I felt it was important to start with some of the background. Previously, the National Science Foundation actually funded a council for big data ethics and society. That work started in 2014 and concluded pretty rapidly in 2016. Can you see that I've switched the slide, Jared?
Yes. Yes.
Perfect. Okay. So the work wrapped up, and this is actually both kind of sad and mysterious. So we tracked them down, and some of the things that we learned are that they did actually publish several very comprehensive white papers that we'd be willing to share with you if we continue our discussion together about ethics and big data. But really the culminating piece that we'll pour through today in some detail is the PLOS Computational Biology 10 Simple Rules for Responsible Big Data Research. And sort of the take-home message is that data are people. Many of the crew that built this council for big data ethics and society have they've gone back to their day jobs when the project ended, and some have continued to publish, but others sort of drifted through the Data and Society Research Institute, which is also funded by NSF. So while their work is not in the least focused on healthcare, they are really sort of leading the charge right now on ethics of big data in society. So I won't summarize the 10 rules, and instead I'll hand it over to Jared.
So hopefully this is the only slide that I'm going to read verbatim, because these 10 rules are the culminating work of that council. And I think they bear hearing and saying. We'll go into some detail on each of them for the rest of the presentation. But rule number 1, acknowledge that data are people and can do harm. Recognize that privacy is more than a binary value. Guard against the re-identification of your data. Practice ethical data sharing. Consider the strengths and limitations of your data. Big does not automatically mean bigger or better. Debate the tough ethical choices. Develop a code of conduct for your organization, research community, or industry. Design your data and systems for auditability. Engage with the broader consequences of data and analysis practices, and know when to break these rules, which is my favorite rule. So rule number one, acknowledging that data or people can do harm. They cite a study that was done by several, by a team of big data analysts that using publicly available data sets and a lead from an investigative reporter, they were able to identify with some very concrete certainty the identity of the UK street artist Banksy. Using that as an indication is that publicly available does not necessarily mean that it's safe to use to identify people, because clearly Banksy doesn't want to be identified, and they were able to identify that it was a male, where he lived, that he was married and he had children, and they had his identity, and it was redacted from the publication, but clearly this was someone who didn't want to be found, but these folks did it through publicly available data sets. Also, other data sets can be used to basically demark populations for certain behavior or treatment based on business decisions, political decisions, and other problems like that. So one of the rules, assume that data are people until proven otherwise. No one gets a pass on ethics. Slide. Privacy is more than a binary value. So when we think about privacy, you tend to think of whether it's public or private, but I can have a semi-private conversation with a group of people that also seems to be in public. Say I'm at a restaurant. Keep in mind the context of what the data, of where the data is coming from, and understand that data protection laws are the baseline minimum of ethical behavior. So basically, they're not really ethical behavior. Reusing data sets for exploitation is also another way that privacy can be violated, even if you handle your data in a private way or respectful of the folks that you're collecting the data on or where it came from. Its reuse can also do harm. So the publicness of data is not the same as harmless, nor is it consent. Slide, please. In your work, guard against the re-identification of your data. The whole point of doing big data analysis is that we can discover correlations that previously we wouldn't have anticipated or been able to rationally deduce. In that, we can also not assume that our de-identified data sets cannot be re-identified later if we're combining them with other large data sets. So it's going to be difficult to anticipate where these breakdowns will come. There's some rules later on here that, that address that. But the vulnerable data points are hard to identify, but we got to do the work to try and do it up front, because once it's out there for good. And if people are going to use a large data set that you or I have developed, and then they recombine it with their own data sets, very real potential that we can re-identify the people that contributed to it. So minimize the re-identification vectors in the published results at a minimum. Slide, please. Practice ethical data sharing. So contrary to this public-private conversation, and it's ethical to keep people's identities, anonymized, there are also certain contexts in which the human participants expect us to be sharing data, and especially in the health realm, if you think about rare diseases, in which there isn't enough critical mass of data to really get at a solution for these issues. The participants in the research expect the researchers to share the data widely and broadly so that they can get enough information to do the kind of correlations that big data promises. Along that lines, IRBs are ill prepared for what big data is going to be throwing at them in the health realm, because a lot of times it's collected by non-research entities, industry entities, and are not governed by the federal regulations around the construction of IRBs. In a lot of cases, IRBs treat the secondary data as not needing consent, not needing oversight, because they see it as traditionally having minimal harm, but that's not the case when we start getting into the real work of big data. Also, we should feel obligated to push back on the funders with ethical concerns about how they expect the data to be shared. If there are problems with what we see in the policy of an FOA, we should communicate that openly with funders. Share is specified in the protocols, but be proactive about harm from informally collected big data. Slide, please. Consider the strengths and limitations of your data. Ground the data sets in the context. This includes acquisition, what the regulations were under and the environment under which the data was collected. Be careful in your interpretation of your findings, because as anyone who's ever gotten in an email argument, it is easy to misunderstand the emotional impact of what the words were meant. careful about your dissemination, that the reuse of whatever data sets you end up publishing or sharing, they may be used or interpreted other than how you used or interpreted them. And to help eliminate these issues, always track the provenance of your data. Document the evolution of your data, don't overstate the clarity, and acknowledge multiple meanings of the data. Slide, please. Debate the tough ethical choices. This is sort of a frontier for the ethics of research. And as I mentioned before, IRBs are not well prepared for it, and a lot of computer scientists aren't really thinking about it. So it would help us all if we have multiple conversations across the discipline kingdoms that are involved in what data we're using and how we want it applied. It's going to be imperative on the ethical application that we understand the methods of other disciplines and how data was collected and the tools in which they use or the assumptions that they make when they're doing their analysis. And that will help us figure out and work through the larger ethical implications of a big data analysis. Engage colleagues and students on big data research ethics. Slide, please. Develop a code of conduct for your org, your research community, or your industry. As researchers, we have very codified expectations of the responsible conduct of research, in which faking data is a cardinal sin. In this context, faking ethics should be as cardinal a sin as faking data. Keep the tough choices in the debates, in the work, during the research workflow, and make sure that, because we're mostly using publicly available data or data that's derived from the public or paid for by the public, keep the debates public, because the infrastructure of billions of people is where we're getting our data. It actually belongs to them, not to us. And keep in mind that regulatory change is definitely coming. It will likely be behind the curve, but it's going to be there. We're going to pay attention to it. Unethical research brings problems to an entire field. You may think that you can get away with it in your own arena, but if it comes discovered, it makes us all look bad, and we will all get very mad at you. So, slide, please. Design your data and systems for auditability. Document your decisions. This will help track back to when there are future problems with the data. You can go back to find out where the weakness entered into the data set. It also helps with defining replicability. The auditability of your data sets also helps us standardize across apples and oranges down the line. So plan for and welcome the audits of your big data practices. Slide. Engage with the broader consequences of data and analysis practices. So if you think about the infrastructure that big data scientists rely on, it requires an enormous amount of energy to collect and maintain that data because it's industry and it just uses a lot of energy. For instance, how is our use and reliance on this data and this infrastructure impacting climate change? The aim of research has to go beyond understanding the world to improving the world, at least in the publicly funded sphere and what the public expects scientists to be doing with the research and the purpose of it. So recognize that doing big data research has societal-wide effects. And I would also add, when you're doing your stuff, consider the output. When you get to the end of your work, how could your work be weaponized? That should be the ethical question. Slide, please. And know when to break these rules. So anyone who works in epidemiology or public health is familiar with when privacy and consent becomes a lower concern in the cases of natural disaster or public health emergencies, where it's more important to quarantine than it is to respect individual privacy and where that balance falls. However, we should also be able to be aware of how, over time, emergencies can be a placeholder for convenience when it comes to circumventing regulations and codes of conduct by researchers. So as long as we continue to engage in the tough debates and allow for auditing of the data sets, we will hopefully be able to avoid that slide from convenience into emergency. And just as privacy is not binary, neither is responsible research. Ethics is often about finding a better, not perfect answer. Responsible big data research depends on more than meeting checklists. Slide, please. And Tracey, I will turn it back over to you.
Great. So we also assembled some other additional resources for people who are interested in this area or in this topic area. So just different data sets, especially the exciting work for the Council for Big Data Ethics in Society. There were a number of white papers that they produced that might be interesting to anyone who's dialed in on the call. Forbes has covered this, and I know that because I come from a health background, we're actually rather well prepared to deal with ethics in general, ethics of research. And I think that that's an advantage of being in health when we talk about protecting human subjects. And Jared is actually from the same health background, which makes us, unique in NSF, but I suppose not in a working group called Smart and Connected Health. We thought that with the time that we have, it's 12:48 now, and I can't see my clock looking at the computer because I'm in screen share mode. We'd like to engage in a discussion. I can really only see 3 other people who I don't know that are on the call, and I suspect one of them might be Carl. So in terms of discussion, if you could please introduce yourself and your institution, and then there doesn't seem to be a mechanism in Zoom for hand raising, so we can just blurt it all out.
Tracey, there's about 24 or so people on.
Well, then I'm glad I didn't say any curse words. So everyone's having a delightful lunch.
Yes, and reminder to folks that this is being recorded and will be posted on the South Hub YouTube, so maybe mindful of that as well. Gary Clifford said there's a little chat box that you could raise a hand there in the chat box.
Also, if you click on participants, the participants icon at the bottom, it pops open a window with an option for raising your hand.
Ah, wonderful. Okay, so the first question we're getting is people want to know where they can get the slides afterwards, and I think we'll coordinate with you all to get a blog post put up and with a link to where the slides are, so people can check the South Hub blog within the next week to find that. I'm going to call on someone to get the conversation going. Gary, you're on here. It's been 2 years since this report. What do you see some of the new and emerging issues that perhaps may not have been covered in the principles, or are there principles that were laid out where you've seen those are the ones where we really need more research in that area?
Sorry, I'm trying to unmute my video. You're not going to get any video feed from me, but you've got my microphone, I think.
We can hear you loud and clear.
That's good. You just can't see me, but that's probably a good thing. Hang on. The host has asked me to start my video. Maybe that works.
Oh, voila! I see you now.
Do you? Oh, good. I don't see me or anybody now.
You're like looking off into the distance. It's very.
Yeah, because my monitor's up here. Sorry.
Yeah, it's rather prophetic.
I'll stare at my green dot and assume people can see me. I don't know. I think what's become my hobby horse on this. So I think what's probably become very apparent in the last couple of years is not just the issue of privacy, but of course how that's disproportionate in disparity populations, and how we address that, not just from empowering the users on the ground to understand that, but also empowering the infrastructure and the people who create the tools that we use to leverage big data to be more equitable as well. So in other words, if you have a bunch of people who look like me making the software, then they're going to make sure that it works very well for people who look like me. But that doesn't mean that it's going to work very well on, the camera facial recognition is going to necessarily work very well on dark skin in a poorly lit building in a low to middle income country. So there are, it's going to work very well on a white face in a very light LED lit office. But, if it's not, if the inclusion of the people who are disadvantages are not there in the actual creation of it and the definition of what's useful and what should go into the product, then I think that's essentially unethical in that we're placing implicit biases into the tools themselves. And therefore, how do we address that? And that's a difficult question, obviously. But I think AI can help us.
Tracey and Jared, do you have a response?
I was just going to say that. So in my day job, one of the areas that I study is racial disparities or disparities in health, and particularly in the past in low and middle income countries. And I think that the inclusion, when we talk in healthcare, again, I'm going to go back to what I know and where I'm at home. We talk an awful lot these days about including our customers, our patients, our consumers in research, communities in research and driving research. And I think that this transition, that you suggest, so what I'm hearing you say is that if we don't include diverse populations in the development of tools that will capture big data, we risk implicit bias when those tools are implemented.
Exactly.
Yeah. So if no one has been sort of writing about that or discussing it, like, I would like to either learn more or do more, because I think that the need for community engagement to prevent implicit bias is something that might be less explored.
Yeah, if we take a look at the interesting resources, there's a book that I listed on there called Algorithms of Oppression. I was actually led to that book by one of the podcasts from the Data and Society Speaker Series. The author was on there and was talking about, and interesting, Gary, when you talk about AI may be helpful in this, there's always a dual use kind of problem with intervention. So there's always going to be a side effect. And what she points out is that if the algorithms have been trained on biased data, then we are generating biased algorithms, and the AI itself is going to be biased. And we've seen that when they've done some of the machine learning experiments on trying to triage judicial cases, and that it came out that the more likely folks that should be convicted according to the machine learning algorithms were going to be African American males between 18 and 25, because that's the data that it was trained on. So if we aren't thinking at the very front end on how the algorithms are being built and what the AI is being trained on, we're just going to be creating racist AIs. That's going to make the problem even worse. So this book is about how technological redlining is very evident in search engine algorithms, and how Google, the difference between Googling young white women and the phrase young black women presents very distressing results, differences in results. So that is a resource, and that is a conversation that's happening. I just don't think that it's as broadly considered, especially when we look at industry and how the profit incentive is driving big data analytics from an industry perspective that doesn't particularly care so much about the ethics of what they're doing.
Oh, and I want to thank Lauren for popping in by saying that Algorithms of Oppression is a great book. Lauren, did you have something that you wanted to add? Hello, I can see.
Hi. So I'm interested.
The lighting's perfect where you are.
Thanks. That's not always the case. It's almost never the case. So thank you. So can you hear me?
Yes, perfectly.
Okay. So I'm actually very interested in this, both from a personal research standpoint, but also because I sit on a committee that the Association for Computing Machinery has, the Future of Computing Academy. We have been thinking about the role of peer review and what we can do as we publish individual research contributions. So I don't know if you saw this blog post, but I'll share it now. Basically, a number of us are concerned that attending to some of the issues that we need to attend to in order to mitigate the negative impacts of our work requires not just industry participation, not just program manager participation or PI participation, but the participation of everyone who contributes computing contributions, be they open source contributions, be they in research and publication venues. So we have argued that authors should acknowledge potential negative broader impacts of their research to spur, new lines of research that can help mitigate those negative impacts, and also as a forcing function to kind of help connect computing researchers with social scientists, ethicists, critical theorists, other disciplines that can help us understand, because we don't expect that computer scientists will automatically, right, sort of be able to project, right, and we're asking people to do speculation a little bit, right? We know that we haven't been trained in some of the disciplines that are required to really understand when our work could be used exploitatively or for unintended purposes. But we can do a better job connecting to the relevant disciplines, and so that's what we're kind of arguing for. So I would also just love if anyone had opinions about that, or if anyone was or a follow-up discussion. I'll put my email here, and I'd love to hear thoughts about that.
Hey, Lauren. Good to see you on the end of the camera.
Yeah.
Work through a different grant mechanism at the NIH, so it's funny seeing you here. Good to see you. So I have a comment on that actually in terms of I like the idea of doing that in the peer review process. I guess I'm the deputy editor of a journal, and I'm always thinking of how to improve the peer review process, because we all know it's fundamentally broken. And one of the things that worries me about this is that it's in some sense it's open-ended and vague, and that we need very strict metrics on how to implement it so that people with good quality research won't getting into endless battles about the actual impacts of their work, where those things are very hard to put your finger on. So as long as they didn't contribute to a rejection per se, as long as somebody addressed it in a meaningful sense, then I think it's a great idea.
Thanks, and I really like that point. We're actually writing a follow-up blog post right now where we clarify that the intention is not to reject work because it could have a negative impact. The intention is to, where it's possible to be transparent about those impacts, to actually share that so that we can, as a community, can decide how to tackle them. But we don't think work should be rejected. In part, that happens now, actually. So being on program committees, I see this happen where someone has an ideological objection, and that is a little bit outside of the realm of the scientific methods used in the paper, right? And that clouds the judgment about the paper. So I guess I would argue that that already kind of happens. And what we're trying to do, as you suggest, is make it a little bit more formal, trying to understand what, if we wanted to address negative impacts, how do we do a better job? And at first it'd be very exploratory, and we would absolutely not recommend rejection based on the potential for a negative impact. So yeah, this is complicated stuff, really complicated. And then there are things, of course, that when we deal with national security issues and things like this, that it's not clear sometimes when the benefits outweigh the risks. And so if people are are bringing their own personal judgment to those decisions, that's a recipe for disaster, basically. So so yes, all the things you said, Gary, are right on, and we have to do a lot more follow-up.
So to sort of keep it going, I think that, Lauren, you raised so many great points there about the challenges. And when we think about big data and publishing, which you touched on with Gary right at the end, is the idea that should there be guidelines for consideration when you get to the end of a study on how you report the potential risks of damage to the human subjects or risk to the people in the data set. What might be those ripple effects? Are there guidelines? There's all sorts of guidelines and consort statements and the AmStar and different reporting mechanisms that are required for secondary data or for big data publications? Should there be a set of guidelines for them? Might be one way to proceed. But on the research development end, what brought me to the ethics of big data was the idea that when I do research that might include human subjects, I actually have to be CITI, certified. I have to, all of us who work in health or who work with people in our research and consider ourselves working with people, we're trained, right? We're trained on the big three rules, that we do no harm, that we help people, that we include people fairly in our research. And that's not a universal consideration for other disciplines, but certainly not for big data, because often people will feel they'll violate that rule or not understand the rule that data is human, so there's people out there. So I think that there's many different ways that we could go.
So, Tracey, I think you've mentioned a challenge. We're now, of course, seeing so as you say, where your health professionals are very familiar with the kind of guidelines, and they've been fairly well developed, although still a lot of challenges. Now with the data science community being somewhat new to this space, or we have new data science folks, how do we begin to bridge across these disciplines and share out some of these lessons learned and best practices from the health world into these other spaces, research spaces? But then at the same time, I've heard concerns from researchers outside the health world that some of these restrictions can be overly restricted and kind of stifle innovation. So how do you find that balance, and how do we begin to bridge across these disciplines? And if anybody else wants to jump in, it doesn't just have to be the panel.
Especially people on the phone, that would really be who we don't have a visual on you. It would be a pleasure to hear your dulcet tones. And
yeah, I see Mark DeLong, Mary Whitten, people I know, Bernadette, Andrew, I see you lurking there. Please jump in. Well, yep.
Silence.
Okay. Well, Tracey, maybe you want to answer that while someone else is unmuting themselves.
Well, I'd like to point back to a couple of the points that they make in the paper, in the 10 points, debating the tough ethical choices. Keeping the debate public, I think, is helpful. Obviously, it's going to include all the messy human stuff where egos get hurt and people have personal stakes in the outcomes of what's judged as ethical or isn't ethical. But really, the only way to do this is in a public forum that is open to scrutiny from multiple disciplines. So, what can we do to encourage that? I mean, let's have a conference. Let's start a journal. Let's But I think that a more public and less traditional method of dissemination, which I don't think biomedicine is necessarily prepared to take the lead on. However, I think that bioethicists will probably have a lot of experience under their belt to help contribute, but certainly don't have enough of the technological grasp to understand what the impact on innovation is going to be if these restrictions are traditionally applied. I think the public debate is going to be the way to go on encouraging folks from different disciplines to start talking to each other.
So I see Bernadette sent a message about textbooks of how do you get it at the intro level when folks are, starting their, say, undergraduate degrees or graduate degrees in spaces that are data intensive fields. Bernadette, do you want to add your thoughts on things you've seen that work to getting folks early on in their careers?
Am I unmuted?
Yep, you're unmuted.
I'm new to the field of data science, and I am participating in as many things like this as I can, but what I'm finding to be most difficult is that there's nothing available for me to use in my classes that's aimed at general curriculum. And 10 years from now, critical thinking with data is going to be a pillar in the general curriculum everywhere. And we have to provide the resources for people to teach those courses. And then if there are those resources and people are teaching those courses, then we can include these kinds of topics.
Gary, Tracy, Jared, or others on the phone, are you aware of good resources that have been used in classes at intro level data science?
So the answer to that, I think, is no. I think that it's actually the idea that we have to take what we've been doing in health, where we require sort of our master's level students to get the human subjects, the human research subjects protection training, the CITI training. It's new to them, and it's new to them. But I don't think for people working in just not biostatistics, but statistics. For people working in data science, for people working in transportation and fisheries, I think that there is the sense that this is a requirement or even necessary, that the onerous burden that we carry in health research is poorly understood by other disciplines. And I think that maybe there is the need for the development of materials to inform people in other sectors about what we have learned, these hard lessons that we've learned about protecting people who are data.
We are working with Pearson and JMP Jump Software on introductory materials for classroom use. Helps us overcome the cognitive burden of coding so that we use introductory data science concepts. But we're just beginning that process.
Great, thank you. Mary, I see you've unmuted yourself. Did you want to jump in with a comment?
Yes. I'm in computer science at UNC Chapel Hill and do VR, which is just a really fancy human-computer interface. One of my students, I made all my students who did user studies, excuse me, take the undergraduate experimental design course down in the psychology department. And so they got a good grounding. They did a pilot, had to do a study. It usually ended up being a pilot. It worked out great. I was lucky that everybody thought that was a good idea. One of my students she said, we should teach a course that is half statistics and half how to do experimental design, including all the ethical issues and how to design a study before you do the IRB so that the IRB isn't so onerous. I don't have any students anymore, so I haven't done anything from this, and she doesn't have graduate students where she's teaching, so I don't know how that, but a set of course materials that were on those topics would really help those of us who are in disciplines where studies are done, but the department themselves don't have the training. And this is obviously beyond CITI training.
Mm-hmm. Yeah, when I was thanks, Mary. When I was at the University of Wisconsin doing my degree in geographic information science and remote sensing 30 years ago, the question of ethics and data came up. And this was before the field of geospatial had a ethical code of conduct. My advisor at the time, Steve Ventura, set up a 6-week module class, and all students in our program was required to take it, called GIS and Society, and the whole class was focused on ethical use, appropriate use of the data, and some of the issues. As a class exercise, he had the class develop a model code of ethics for the geospatial field. And as it turns out, that code ended up being used by the Urban and Regional Information Association. They, took that, adapted it, and then required all their members to agree to that to become a member.
So an interesting thing is that ACM has just yesterday, published a new statement of ethics, and I have not read it carefully, so I don't know if it addresses any of the issues that would come out. But Leah, I will look at that and see if there's any comments I can make to you on that offline.
Yeah, DJ Patil, former chief data scientist of the United States, just published a blog with some folks about the ACM ethics. So I've just put the link in there. I think that's, at least that's what's posted right now on their website. But I wonder, I think the suggestion of course materials is outstanding. And I wonder if the National Academies has had a data science curriculum working meetings, and they've got a report coming out, whether that is already being looked at by groups or whether this is something the big data hubs might help to foster. We haven't heard from a lot of other folks on the phone. There may be other issues they'd like to bring up. I see Brittany, Cass, Ellen, Lauren, I think you spoke, Mark, Sunkey. Anyone else want to jump in the conversation, issues that they think are important in research and ethics, or data science research and ethics? Oh, Bernadette says a report just came out from the Academy. Bernadette, if you'd be so kind as to put the link in the chat box for people, that would be tremendous.
I'm looking for it.
Let me just say one more thing about course materials. People who are in the more engineering fields, and I consider computer science and engineering when it's taught properly, it needs to be done so that it appeals to people, or people who are in those disciplines can relate. We do think differently than people in social sciences.
So perhaps you could elaborate on that. How might it be different in the discussion on ethics and data with engineers versus with social scientists?
We're not afraid of math is one thing, because most of us have had a lot. It has to be done so it's not so, has to be not horribly touchy-feely, because that puts engineers' backs up sometimes.
Mm-hmm.
Hard to say. Tracey, you're laughing a lot. Have you had experience with this? I think she said yes.
I mean, economics is a social science, right? I mean,
it is actually a social science. Sometimes you have to remind them. It's not just widgets, it's people.
and many of my colleagues see no reason that they should have to do IRBs for what they do.
But that's the truth, right?
Yeah. Oh, it is the truth.
Whereas I don't think the PI gets to pick. I'm the weird one. So when we talk to people about this, they're like, well, that doesn't apply to me. So it's really, and I think it's just how people are trained, how we're taught when we're infants in our field, what the norms are.
Indeed.
So
I just want to make one more comment regarding the further research on empirical and theoretical work. So I do a lot of work with adolescents, and adolescent data privacy is a wide open space that we know very little about and when it comes to health. So if anyone is interested, we just published a paper in JAMIA, it's a multi-center study where we looked at decision-making factors for why they would or would not make certain adolescents' data available to parents and adolescents. So I can share that, but also if anyone has more information about this or is working in the space of particularly vulnerable populations, again, all patients would be considered vulnerable, a vulnerable population, but there are particular data custodian issues, right, that come up with older adults and with minors. And so that's an area of personal interest for me. If others are interested, let me know.
So we just got a comment from Ellen. It says, the problem is hard questions are hard. Ellen, would you like to jump into the conversation?
Sure. I mean, I just heard the comment about the touchy-feely issue, but even going back to the Belmont report, like what they say at the end of that is, we don't know every case. It has to be case by case. As you get to the harder questions, there has to be a discussion. And I do think in the social sciences and the health sciences, people have just internalized this idea that you deal with humans, whether it's direct or indirect. And I'm a sociologist, so from that perspective, the idea that IRBs haven't been dealing with data privacy issues for the entire history of IRBs is a bit amusing, to say the least, because we've always been concerned about the addition of the issue of de-identification, things like that. So, but not other disciplines haven't necessarily thought about in that framework because they're not used to dealing with data in that same kind of way. So, I mean, I think there is like a culture change that has to happen across disciplines where everybody's thinking about it in a more complex way, including computer science and HCI people, and including health people, and including social science people, because it is, and even humanities people, because there is just this these issues have become much more widespread for everybody, and implications, especially on the privacy side, have just become much more massive as we have this really strong push for data sharing, which is really important. We have this really strong push for reproducibility. That means a certain amount of risk of exposure for people, and how do we balance that? So that's where my comment comes from.
Well, that was a really thoughtful comment, because I think that there aren't easy solutions right now, especially where we've all, on the social sciences and health side, we have internalized our beliefs, because it's like looking both ways before you cross the street, right? It becomes a habit, but it's a learned habit. It's not human nature. So.
This is being mindful of the time.
That's where I was going to go. I was going to ask Jared if he wanted to. We've got a slide full of potential future directions. I don't think that I need to read them out loud to people, and I think actually we've hit, Leah, on a number of these issues, don't you?
Well, my old eyes are a little hard to see. Other than the big bullets. So maybe just getting a broad brush of the 4 categories, and then getting maybe a sense for people where they think perhaps a lot of the energy should be put in among those many items. What would be their priorities? And then second, mention the workshop we're now nucleating, and where they think we might want to spend some of our time in that workshop focusing on.
Well, I can highlight that these potential directions come from the work of the council. It came from their white paper, and it's sort of a shortened version of all their recommendations. Interesting that a lot of the concerns that have been voiced here are things that they came up with back in 2016. So they're not new. I think that part of what should be expected on us is to continue amplifying these things that people have already been doing work in and modifying them as we go. But the work's been there, the groundwork is laid. Now we just need to kind of build on it and make it louder and figure out what things we've missed or what they've missed and what we can contribute.
So those are really great points, Jared. So for those of you who don't have their screen on full screen, or just are listening without access to the slides, it's policy matters like the common rule, which has changed and being implemented slower than I think many people would like. The pedagogy, which we discussed in our groups. How do we teach this? How do we get ethics into the curricula of different disciplines? The network building, which I think the data hubs from NSF are like a great example of how to bring different disciplines together to share space. And then additional research that needs to be done, because of course most of us on the phone are scientists, and there's always more work to be done. And I think that's my last slide actually, but in terms of the more work to be done, so I am not funded through NSF and the South Data Hub or through NSF at all, but I had an unselected proposal with that at the end of what would have been very expensive and given me a postdoc, we proposed a sort of interprofessional public-private sector roundtable discussion. And I've recently, a partner of mine at the Uniformed Services University, so we are the Department of Defense's medical school. It's a very interesting model, but it's more than just med school. We've got nursing, we've got dentistry, we've got a College of Allied Health Sciences, but many of us, including me, we run centers that are very well funded. And I sat down next to the person who would have been my co-PI. And if you've been following any of the Army STARS or resilience work that's come out that uses sort of big health data to predict suicide amongst a population that's considered at risk, to try to identify those who are most at risk, to ensure that they're able to sort of cut them off left of the boom, as we like to say in the DoD, sat down next to me at a meeting. And so we've been discussing, he runs a forum series called Health and National Security. And so Jared, Leah, and I have been sort of marching out with the idea of hosting one of these health and national security forums, probably on the 8th of November, all day long. There'll be roundtables and keynote speakers, but it will be the ethics of big data for healthy communities and a healthy nation. Because of course, and we might look at things like how data ethics relate to resilience, lessons from healthcare ethics that can be applied to other sectors. So we could take some of these potential future directions and roll them into that. It's still very nascent. I know that there's money, and I've booked a room, and that's about as far as I've gotten. I've got ideas of people who work with big data and big data ethics in different agencies that I'd like to invite, but I suspect that each of you have your own perspectives that you would bring in your own institutions. So I look forward to learning more and keeping you all well informed as we move forward. And I actually have a very, very hard stop at 1:30, Leah, so I'm going to hand it back to you now.
Great, let's see. All righty. Well, I guess thank you all. If you have additional comments of the areas where you think we should prioritize, please add them to the chat box here, and we'll record that in our notes. A webcast, archived webcast of this discussion will be posted to the South Hub YouTube account. I'm hoping, Tracey and Jared, you guys will be willing to share the slides as a PDF, along with links to the reports that have been mentioned. And we will put that up on the South Big Data Hub blog. I've included, I think I just did a moment ago, a link to where you can find that at 1:24 p.m. in the chat. You can find the link to the Hub blog, so look for it there. It might take us a week or two to get that up because it's the summer and people are on vacations. And then also want to mention that we hope this is going to be the first of many discussions on a monthly basis. We'll probably fire up officially in September. So if you'd like to join that group and help us guide where direction should go, you're at the ground floor. Please join. Carl has just put the information up there on the screen. And with that, I want to thank our